this crisis that preceded the COVID pandemic, but throughout the pandemic has become that much worse.
Exhausted, overworked, and ready to leave the profession. That's what we heard from healthcare workers at a press conference today about the staffing shortages in Washington hospitals.
People are leaving because of the burnout and the stress that those people aren't there for us. And then what that begins to do is trickle down into the patient's safety.
A collection of healthcare worker unions announced the launch of the Washington Safe and Healthy campaign. It's focused on addressing the staffing crisis through legislation in three main ways: by putting safe staffing standards into place, enforcing existing overtime, meal, and rest break laws, and investing in workforce development to recruit more workers.
Calling us heroes is not enough. It was never enough. It is time for the hospital executive to step up for the frontline workers who have sacrificed so much.
Representative Mike Sells, chair of the House Labor and Workplace Standards Committee, gave this statement to King 5. It reads in part, "During this next session, it is a priority to look at what we can do to make sure those workers have the assurances and safeguards in place for their well-being and that of their families." Representative Michelle Caldier with the Healthcare and Wellness Committee says she's currently working on a bill. Her statement said in part, "My bill would prioritize healthcare slots in our capital budget so the colleges who have included training healthcare professionals would receive taxpayer dollars first to build those programs." Well, the legislative session starts on January 10th, and the Washington Safe and Healthy campaign says that they're working with lawmakers to draft that legislation. Live in Seattle, Kayla Lafferty, King 5 News.